The new breast cancer screening guidelines handed down from the American Cancer Society have locals speaking out about the changes. And 23 ABC's Jessica Harrington is here in studio now to tell us what those people are saying. Jessica.
Well, the new guidelines have many confused and unsure about what to do, but one local cancer survivor says she wouldn't have changed a thing, and it saved her life.
From one year to the next, there can be a huge difference in change. It could be a life-threatening type of situation.
The advice from the doctors now also changing when it comes to women's health and breast cancer screenings. New guidelines released this week say women with an average risk of breast cancer should begin annual mammograms at 45 instead of 40.
Well, I think every 2 years is okay if you don't have family history, which is some of the recommendation.
At age 55, women should have mammograms every other year, but can get them annually if they want to. And breast exams from a medical provider or self-exams are no longer recommended, something local breast cancer survivor Kelly Sanders says she doesn't agree with.
I wouldn't go off of those guidelines for nothing.
She says after a friend was diagnosed with breast cancer in 2013, she did a self-exam and found a lump. Shortly after, Sanders was diagnosed with stage 2 breast cancer.
You know, mine didn't, you could feel it and it didn't show up in a mammogram.
Sanders had to undergo chemotherapy and is now in remission. She says she's glad she did the self-exam. Say the best way to treat breast cancer is early detection.
Picking up cancers earlier, where the treatment is easier for patients, we can spare patients mastectomies or chemotherapy, is very important for the 1 in 8 women that are going to be diagnosed with breast cancer.
But the American Cancer Society says they're changing the guidelines to help avoid unnecessary stress that the tests cause.
If she starts screening at the age of 40, she increases dramatically the lifetime risk that she's going to have a false positive result, that she's going to need a breast biopsy that turns out with the doctor saying, well, you don't have cancer, sorry, we put you through all of this.
You know, it is scary, but it's worth it.
The American Cancer Society says everyone should talk to their medical provider to figure out when to begin screening for mammograms and how often to get screened. For a full explanation of the new guidelines, you can log on to turnto23.com. Reporting live in studio, Jessica Harrington, 23 ABC.